and thank you. Okay. When we speak about HIFU or uterine fibroids and pregnancy outcomes, it's impossible not to speak about some epidemiological facts. Principal, the age factor, okay? We all know that currently there is a tendency to delay childbearing beyond to the age 32. Mainly the Western countries, of course, and this situation combined with the increase of fibroids with age leads to us a new scenario, which is the large number of older patients with fibroids and problems conceiving, okay? Unfortunately, the advances in new reproductive technologies cannot compensate for this issue, and patients undergoing in vitro fertilization suffer for recurrent implantation failure or miscarriage. And of course, this is an important economic and of course, economic problem and social problem. Well, but focusing on uterine fibroids, you know, they may the sole cause of infertility in 1 to 3% of women and be the cause of 7% of recurrent miscarriage. Of course, submucosal fibroids of any size and intramural fibroids distorting the uterine cavity have the most negative impact on fertility, with low implantation pregnancy and delivery rates in comparison with women without fibroids. On the other hand, some authors support the idea that intramural fibroids greater than 4 centimeters, even without cavity distortion, may also impair fertility by different pathological mechanisms other than distortion of the uterine cavity, as the increased uterine contractility, the impairment of the endometrial and myometrial blood supply, chronic endometrial inflammation, etc., etc., etc. Moreover, uterine fibroids also increase the risk of pregnancy complications, you know, such as abnormal fetal position, premature rupture of membranes, and other problems during pregnancy and delivery, okay? And what else? Okay, what is the standard today? Currently, unfortunately, laparoscopic myomectomy is the standard treatment for patients with uterine fibroids who wish to conceive. However, in recent decades, less invasive treatment options have come available, one of them HIFU. And okay, you know, high-intensity focused ultrasound is a non-invasive tumor ablation technique using a special transducer. The ultrasound wave passes from the skin and through different tissues and are focalized on a point deep in the abdomen, okay? And in the target organ, this leads to high temperatures between 60 and 100 degrees, resulting in necrosis in parts of the fibroid. And okay, as you can see in the images, the ablation is guided by real-time ultrasound. You can see, this is the images during treatment, okay? And this is a treatment. We make an ultrasound pre-scan on the sagittal view during different sections with 5 millimeter separations. And we start to treat the deepest area. You can see here changes, echographic changes, echogenic changes in the posterior zone, posterior area, okay? And we finish treating the shawlless areas, finally, the medium and finally the shawlless areas of the fibroid. We consider the treatment completed when we see hyperechogenic changes in the entire fibroid, indicating a complete ablation of the tumor. You can see here in these images, okay? Well, after HIFU treatment, the treated fibroid is absorbed by the tissue nearby, and the uterine structure and uterine cavity gradually return to normal. This is the intention, okay? Okay, this is very important. The main advantages of HIFU, you know, are, first thing, there is never bleeding or infection, never. This is a typical complications of conventional surgery, okay, but not with HIFU. Never bleeding, no infection, okay? There is only mild postoperative pain. The procedure is done under constant sedation. All patients are discharged, all patients in our center, no patient, all patients are discharged between 3 and 5 hours after treatment. Patients have a faster recovery after HIFU compared to surgery. And very importantly, no skin or uterine rupture, or uterine scars, which is of special interest in women with gestational desire, of course. On the contrary, myomectomy has some comorbidities, of course, a uterine scar with 1 year waiting time until pregnancy and the risk of uterine rupture, low risk, but with potentially various serious complications, okay? Well, how about the damage to the tissue nervi? Okay, Dr. Selva and Dr. Cheung has already speak about this before me, but okay, HIFU achieves ablation of uterine fibroids without damaging the surrounding myometrium. There is conservation of the biomechanical properties of the myometrium, and HIFU also seems to preserve ovarian and endometrial function. We have some studies, okay, that show no significant difference in the anti-mullerian hormonal levels before after treatment, and other studies, okay, about the molecular and tissue markers of endometrial receptivity, very, very important in vitro fertilization after HIFU, okay? Okay, in my opinion, the objectives of HIFU ablation of uterine fibroids in women with gestational desire are, on the one hand, to achieve the inactivation, this is my word, okay, the inactivation of the hormonal, vascular, inflammatory function of the fibroid, okay? And this, we achieve this first objective immediately after HIFU, okay? Thanks to the total necrosis of the fibroid. The same day, we don't have hormonal function, we don't have motility function of the fibroid because it is necrosed, okay? That's very important. The second objective, of course, is to shrink the fibroid in order to normalize the uterine anatomy, especially important in some mucosal fibroids, but it's not necessary in small intramural, not distorting fibroids. It's important in some mucosal fibers, of course, to achieve this second objective, okay? But both things seek to increase the chances of obtaining a safe pregnancy without the complications of surgery. Okay, logically, the greater the ablation of the fibroid, the greater its shrinkage during follow-up, of course. Okay. We have, okay, all the experience and all the most important experience and evidence in pregnancy outcomes after HIFU comes from Asia, of course, from China. But over the last few years, several studies have shown the safety and efficacy of HIFU treatment for patients with uterine fibroids who intended to conceive. Large series, 130 pregnancy after HIFU, large series with high gestation rates, obtaining full-term pregnancies with a normal delivery, with few complications and with no cases of uterine rupture. Okay, nowadays there is one case of uterine rupture, only one case after HIFU, okay? Or abnormal presentation, okay. Based on the data currently available, pregnancy outcomes after HIFU appear non-inferior to myomectomy. Both improve the pregnancy outcomes, live birth and miscarriage rate, similar perinatal complication rate. Obviously, HIFU technique has some differentiating advantages, such fewer complications, shorter hospital stay, lower postoperative pain, faster recovery, very important, shorter pregnancy interval in comparison with surgical treatment. Our experience is not so much different from all these publications. In our retrospective study, we included 560 women with symptomatic uterine fibroids who underwent ultrasound guide HIFU between 2008 and 2018. And okay, 71 pregnancies of 55 patients have been obtained. The pregnancy rate was 34%, which is similar to other treatments. Among the 71 pregnancies, there were 43 successful deliveries, including a natural twin gestation, with an incidence of cesarean section of 43%, which was much lower than in patients undergoing myomectomy and embolization. In relation to the 55 women who became pregnant, more than a half, 55%, were at least 36-year-old, very old patient, 36-year-old at the time of treatment. 80% of these women were nulliparous. And we must highlight that 33% had primary or secondary sterility, and 18% had at least one miscarriage before HIFU treatment. It's reasonable to think that HIFU could help to improve fertility in this type of patients. We have to demonstrate, of course. The rate in our series of preterm delivery was only 9%, which is lower than in series of pregnancies with untreated fibroids or pregnancies following embolization. The mean birth weight of the 44 newborns was 3 kilograms, and except for the 1.4 kilogram baby who was born with a previously diagnosed tetralogy of Fallot and intrauterine growth restriction, the remaining newborns, 98%, developed well without complications during postpartum and breastfeeding. These are the few complications detected during pregnancy. We can see only one preterm labor due to polyhydramnios, 2 cases of placenta previa, and 2 cases of preterm premature rupture of membranes. And during delivery, 2 cases of emergency cesarean section, in one case for fetal bradycardia, and the second case for hemorrhage due to placenta previa. 3 retained placenta with manual removal in one case, and 1 case of severe preeclampsia. Okay, it should be noted, sorry, that there were no cases of uterine rupture or placenta accreta. And these results were achieved in women with a medium maximum diameter of treated fibroids of 6.4 centimeters and a non-perfused volume of 76%, okay? Which is higher than that reported in some series. Okay, to date, the number of post-HIFU pregnancies has increased in our center, and currently about 80 women have achieved a total almost 100 pregnancies, of which 62% have ended in a successful delivery, okay? And the percentage of vaginal delivery is similar or higher than 62%, okay? And these are some cases from our series that successfully ended with 1 or 2 pregnancies. You can see a 34-year-old woman with a non-perfused volume, okay, of 100% of the volume, okay, very good results. Okay, we have 2 different patients, okay, here we can see this fibroid in the posterior wall of the uterus, okay, total necrosis, 100% of the necrosis, and in the other case the same, 2 fibroids, a small fibroid, a small size, and this other fibroid, completely abraded with good pregnancy results. And okay, 2 more cases, okay. Probably in this case, the non-perfused volume is near to 80%, which was enough to achieve a pregnancy, okay, and the other case is 100%, okay. Okay, very interesting case. It's a huge fibroid. This is 9 centimeters, okay, transmural fibroid. Probably 95% of the non-perfused volume, okay. The fibroid decreased after HIFU, shrunk, and okay, this woman obtained a full pregnancy 10 months after HIFU with a vaginal delivery. This is a submucosal fibroid type 0, okay, occupying the entire cavity, type 0, okay, completely abraded, and disappeared 6 months later, sorry, no, okay, here, completely disappeared 6 months later. Here, sorry, okay. And 2 months later, after this MRI, the patients achieved the first pregnancy and second pregnancy with vaginal delivery with no healthy babies, okay? Okay, in type 0, the standard treatment is hysteroscopic resection, but in big fibroids, it's very difficult to achieve success with hysteroscopic resection, okay? And we have this publication ultrasound guide HIFU is safer and more effective than hysteroscopic myomectomy in the treatment of symptomatic submucosal fibroids larger than 5 centimeters, okay? And we can do HIFU alone or HIFU and 3-6 months later, hysteroscopic resection with a small fibroid, okay? We can combine both treatments. This is a very interesting case of our series, a transmural fibroid successfully treated with HIFU and with hysteroscopic resection. This is an example of the remaining myoma fragment 6 months later, okay? First HIFU, 6 months later, hysteroscopic resection, and this is the hysteroscopic diagnosed, okay? Completely free of fibroid, okay? And 3 months after this diagnosed hysteroscopic, patient achieved a spontaneous pregnancy with vaginal delivery, 3 kilograms baby with no problem. Okay, we can treat cases of polymyomatosis with fibroids of different locations in the same patient. The submucosal fibroid that you see here, okay, you can see 3 fibroids. There are another 4 fibroids in the lateral wall. We cannot see here, but 4 fibroids, completely ablated. And this is the submucosal fibroid. You can see here the uterine cavity distorted by this fibroid, okay? And this fibroid completely disappeared 8 months after HIFU. And just at that moment, the patient underwent a successful in vitro fertilization and got a full-term pregnancy, okay? And the pregnancy ended in a cesarean section due to breech presentation. Okay, as a conclusions, of course, uterine fibroids can negatively affect fertility and increase the risk of specific pregnancy complications. Myomectomy has some disadvantages that we should consider, especially in women who have decided to conceive, very important. According to our experience, HIFU is an effective and safe treatment for uterine fibroids. And okay, we can achieve full-term pregnancies with a few intrapartum complications after HIFU treatment. It's a good treatment for patients who desire conceive, okay? And due to its non-invasive nature, HIFU could be the first therapeutic option. In our center, is the first option for women with fibroids who wants to get pregnant, okay? To get pregnant. And okay, with many advantages over myomectomy, of course. And in some cases, HIFU could even improve fertility, but we have to demonstrate, and of course, with more and more studies in our center. Thank you very much. That's all. Thank you for your attention.